Hello everyone and welcome to Module 9. As we start to kind of dwindle down to our weeks, there's not as much content, and some of this content is things we have already discussed. But this week we are focusing on the topic of patients with special needs and disabilities. So there's no specific chapter to this in your Cengage book. This week you're looking more along the lines of things relating to, professional communication, and for your CMA test prep, it's more on, administration and compliance. So there's no exact chapter to review, but there are some good things that we do still need to discuss with this unit. So what does the term special needs mean? Shouldn't we really treat every patient with respect and special care? And while that is true, the term special needs means that any patient who might need a little extra help because of a medical, emotional, or learning problem. They have special needs because they might need medicine, therapy, or extra help that other patients do not typically need, or that they only need once in a while. This could include the use of a wheelchair, leg braces, transportation to and from the clinic, Braille literature, speech therapy, TTY communication devices, or long-term services and support. Long-term services and support for patients with disabilities can include both medical care and non-medical living care to assist with normal daily tasks such as eating, dressing, and using the washroom. Some may need care provided at their home as well as in healthcare facilities like hospitals or long-term care facilities. As a medical assistant, you need to ensure that your patients with disabilities receive information concerning benefits, services, rights, waivers of rights, or consents to treatment. In addition, the family may also need additional support to assist with their loved one's care. With that information, it is important to know that patient educations must be adapted to not only fit the learning style, but also the needs of your patient. With all special needs patients, you need to make sure that you, as the medical assistant, make sure your patient understands that information. This can be done by requesting feedback or demonstration from a patient after we teach them. So let's discuss some of the different patient educations for teaching different special needs patients. We're going to start by talking about teaching children. Children have special education needs and should not be treated as though they are small adults and expected to remember the processes of information that are way above their learning level. Children may need to see a treatment or a procedure performed on a doll before having it done on themselves. Also, children love to touch equipment that will be used on them. So when you have the time, please allow that. Let them play with your stethoscope. Let them play with the thermometer. Let them play with a reflex hammer. You can also use coloring books to help teach concepts to children, and give a sticker as a reward as long as the parents are okay with that. And as a child ages, they should be included in their discussions along decisions that are made about their health. Don't just ignore them because they are a child. And it is extremely important that when you're providing education, you direct the education to both the child and the caregiver. A couple of other things that we have to deal with are teaching patients with hearing impairments or visually impaired. Patients with hearing impairments frequently can read lips, so make sure that you face the patient and speak slowly. Be sure that you do not stand with your back to a window or a light source, as it can shadow your mouth. Try to remove any barriers or face masks when you're speaking to a patient with a hearing impairment. And you may need to hire or use an interpreter for patients who are deaf. Try not to use family if you can, because family sometimes does not always relay the proper message. Always make sure that you provide detailed and specific written instructions for patients with hearing aids or hearing impairments. For patients who are visually impaired, this type of patient may not be able to read written instructions unless the font is very large, or some will not be able to read it at all. For these patients, you may need to have audio recordings of instructions that normally would be written out. When working with a visually impaired patient, be sure to clear the clutter from the hallways and the office that might impede the patient, and ask them if they would like a guiding arm while navigating to the exam room. Don't just assume that they want one. Some other special needs that you may run into are developmental delays, mental challenges, illiteracy, or language barriers. Patients with developmental delays or those who are mentally challenged may have trouble understanding complex or multi-stepped educations and teachings. In these situations, you may need to give instructions to the caregiver instead of the patient, but do not ignore your patient, as they still are just that, your patient. Patients who are illiterate means they cannot read or write. And honestly, most patients will not give this information away because they feel embarrassed by it. So make sure that you watch for behaviors to indicate this. Things such as them saying they forgot their glasses, could you read it to them? Or them asking you to read something because they can't see it, it's too small. Or even if they ask you to fill out something on their behalf. With this type of patient education, get creative. That means that you may have to draw pictures or illustrate something out instead of just doing the written documentation. Patients that do not speak or understand English can be a difficulty. Typically, you will know about this in advance, and you can prepare for this by setting up an interpreter. Again, it's not necessarily a great idea to use a family member, as they may not relate the entire message to the patient. And it is important to make sure that you do have patient educations in their native language. With the EHRs now, you can actually change the language up to 40 different languages, I believe. So the information that you give can actually be useful for the patient. And the last topic we're going to talk about is teaching older adults. So with older adults, their intellectual capacity does not diminish, but it merely changes. So you have to pay attention to things like slower processing time, decreased short-term memory, decreased dexterity, and increased anxiety about new situations. We just recently talked about geriatrics, so I'm not going to go over these as that information is the same. But if you do have any questions, comments, or concerns, please make sure that you reach out to me. Alright guys, that's what I've got for the Module 9 video. Again, these are all things that we've talked about in the past at some point, so it's not necessarily new information, but it's good to have that reminder. As we get down to these last few weeks, we're going to spend some time really kind of going over different topics, going back over things, going over procedures, making sure everybody is set up and ready for externship. So please make sure that you come to class ready and prepared with any questions that you do have. I will see all of you on Tuesday morning. Bye, everybody.